so I'm one of the consultant geriatricians in the Trust, and I've been using simulation now for maybe 4 or 5 years. I'm one of the 4th year undergraduate leads for Queen's University students who are coming through their ageing and health attachments. And we'd started using it with the medical students. But really, for me, it's important that everybody within the Trust who is coming into contact with an older person would avail of this training, which we're hoping to be able to offer to everybody within the Trust eventually. And really what we're doing here is ageing simulation or frailty simulation. And what we want to do is try and mimic as best we can what it would potentially feel like to be an older person with certain comorbidities, certain joint restrictions or mobility issues, and sensory impairments like visual impairment and hearing impairment. And for me, it's not enough just to wear the equipment and wear the ageing suits, but it's important then that you go through the workshop and you take part in activities of daily living. So by that, it's sort of basic tasks around things like eating, drinking, household tasks, communication and medications. It's very structured. You will have your pre-brief when you come in just to discuss what the experience is going to be like. You will do the experience and then we talk through it at the end and we sort of chat through the objectives being how has that experience made you feel and how will it potentially change your future practice when you next come into contact with an older person. We had different people here today. We had some doctors, we had and one of our acute care at home nurses. So everybody wore something slightly different. So there was a frailty suit, there was a hemiparesis, which you would have after a stroke. So that's a right-sided weakness. There is also back pain, knee pain, and things like tinnitus. And so everybody does have a slightly different experience doing the tasks. The main themes coming away from that are the frustration of not being able to do tasks easily enough that they normally would, having to ask for help, which people find difficult, and feeling just exhausted and tired. And I suppose the whole debrief and talking through, you know, how will this change your approach to an older person is around that empathy, trying to get people to empathise with older people who might have these restrictions and to allow more time for questions, to really get a detailed social history of how that person lives, and to think about just being a bit more patient. And I know we're all under time pressure, but just allowing that person that bit more time so that you're getting a really comprehensive assessment.
It was absolutely fantastic. I mean, I used to think I had great patience with my patients, but being in their shoes and doing what we've done today, it's going to make me give more time with my patients, because everything takes so much longer when we're living like the frailty that our patients have. It's definitely given me a better understanding of the different impairments our patients would have, of how they live daily with those conditions. I had gloves on that gave me a tremor in my arms, and I had tinnitus, so I had a constant ringing in my ears, and my vision was impaired. So they were really all my senses, and then I had to go around the different stations. I found it really difficult. It made me feel very lonely. I felt isolated. I felt like in a world of my own. I felt quite sad, thinking, my goodness, a lot of our patients are actually living with this daily, and you know, we're out with these patients and we're not really taking time to know how they're actually feeling. Absolutely, now understand how our patients are feeling, and a lot of the times our patients are in poor form. You know, they don't want to eat. I didn't want to eat. We had to cut up a banana. The time I got it cut up, I didn't feel like I wanted to eat the banana. So it's definitely given me a better understanding of what it's like for our patients. Without a doubt, I would recommend this. It's brilliant.